Hello everyone, I'm Dr. Detollenaere, an aesthetic doctor from Antwerp, Belgium. In today's video, we're diving into the aging process by decade, what changes to expect, and the best treatments to keep you looking and feeling your best at every stage of life. With so many aesthetic treatments available: fillers, biostimulators, chemical peels, lasers, neuromodulators, skin boosters, energy-based devices, and even surgical options, it can be overwhelming to figure out what's right for you. Many of my patients, no matter their age, come to me with questions about aging and what they can do to stay fresh and youthful. That's why I created this video, to give you realistic expectations and practical guidance on the best treatment options for each stage of life. Of course, aging is not the same for everyone. While this video will provide general advice, every individual ages differently, based on genetics, lifestyle, and other factors. However, there are clear trends and patterns that I see every day in my practice, and I will share them with you. This information will help my younger patients optimize prevention and my more mature patients understand what's realistically achievable at their stage of life. I just want to add a little disclaimer here. I'm not saying that everyone at a certain age needs to get multiple procedures. I truly believe in personal choice, and my goal as a cosmetic doctor is simply to help people feel and look their best at any age. And if that means not doing any treatments at all, that's totally fine too. The most important thing is that you feel happy and confident in your own skin, whether that includes aesthetic treatments or not. That being said, this video is for those who are interested in looking their best throughout different decades of life. Based on my experience as a cosmetic doctor and working with patients on a daily basis in my aesthetic clinic, I wanted to share my advice and knowledge for those who want to explore their options. At the end of the day, it's all about what makes you feel good. First, I'll briefly explain how aging works and the key factors that influence it. Then, we'll go through each decade, starting with the 20s, followed by the 30s, 40s, 50s, and 60s. Want to skip ahead? I've included timestamps, so if you're 47 years old, you can jump straight to the 40s and 50s chapters to get the most relevant info for you. Aging is not the same for everyone. We all age differently because of two key factors: intrinsic and extrinsic aging. Intrinsic factors are things we're born with, or genetics, ethnicity, and natural bone structure. These determine how quickly or slowly we age on a biological level. Extrinsic factors are things we can control, like lifestyle choices, smoking, alcohol consumption, sun exposure, pollution, and skincare. Skincare plays a huge role in how our skin ages over time, and so do aesthetic treatments. With the right combination of good skincare habits and aesthetic treatments, we can slow down aging, maintain skin quality, and keep facial features looking refreshed and balanced. So, while we can't change our genetics, we can make smart choices and use advanced treatments to help preserve a youthful, healthy appearance. Confucius once said, "The nature of man is always the same. It is their habits that separate them." And when it comes to aging, that couldn't be more true. The aging process. Aging isn't just about wrinkles. It's a process that affects every layer of the face, from the skin to the bone. When we're young, everything is firm, plump, and well supported. But over time, changes happen that alter our appearance. Over time, the skin becomes thinner and less elastic as collagen and elastin production slow down. Fine lines appear, and years of sun exposure can lead to pigmentation and uneven skin tone. Beneath the surface, fat pads shrink and shift, causing volume loss and sagging. Ligaments loosen, making the skin less supported, while bone resorption reduces definition in areas like the jawline and cheekbones. Some people experience more sagging, while others lose volume faster. This is something I've explained in my previous YouTube video on aging types. Factors like ethnicity, skin type, and lifestyle all influence how quickly and in what way these changes appear. That's why everyone ages at a different pace, and treatment approaches should always be tailored to individual needs. If you want to know more about the aging process in general, you can watch my previous YouTube video, How the Face Ages. Aging trends across different age groups. In my practice, I see patients from all age groups. 20-year-olds looking to enhance their futures, 30-year-olds addressing early signs of aging, and perimenopausal women in their 40s and 50s experiencing accelerated aging. I also see 65-year-olds who want to refresh their appearance while maintaining natural results. Recently, there has been a noticeable rise in aesthetic treatments among millennials and Gen Z, largely influenced by social media. It's never too early or too late to consider aesthetic treatments, but having realistic expectations is key. While aging is highly individual, there are common patterns that emerge in each decade. This video will help you understand when to focus on prevention, when to maintain, and when to restore. 20s. Prevention and beautification. In your 20s, aging is usually subtle, but lifestyle habits such as smoking, alcohol consumption, weight fluctuations, and sun exposure can accelerate the first signs of aging. Is there a place for anti-aging treatments in your 20s? Before 25, I generally don't recommend anti-wrinkle injections since most people don't have visible signs of aging yet. However, by the late 20s, subtle changes may start appearing, and early preventative treatments can help maintain a youthful appearance. Early 20s. Focus on beautification. For most people in their early 20s, aesthetic treatments aren't about anti-aging. They are about enhancing their futures, also known as beautification. The most common treatments include lip fillers for fuller lips, toxin in the jaw muscles to reduce teeth grinding and create a slimmer V-shaped face, non-surgical nose reshaping, jawline contouring and facial balancing, such as adding chin filler to correct a recessed chin and create a more harmonious profile. Skin quality improvements, including personalized skin care routines, microneedling, or chemical peels to treat acne scars. The influence of social media and beauty trends. Social media has significantly influenced aesthetic treatments, especially among younger patients. Gen Z is the first generation to grow up fully online, making them hyper-aware of their appearance and how they are perceived. There's ongoing discussion about Gen Z being beauty and youth obsessed. One term that has gained popularity is pretty privilege, the idea that conventionally attractive people receive certain advantages. This concept has heightened awareness around appearance and made many younger people more open to aesthetic treatments. The big influence of certain social media influencers and trends is making aesthetic treatments more widely accepted.
So this is everything I've had done to my face. I'm going to get Botox right after this, so I'll take you with me.
While social media can inspire beauty trends, it's crucial to approach aesthetic treatments responsibly. Some young patients may seek treatments for social reasons, which is understandable, but it's essential to assess whether underlying insecurities or body dysmorphic disorder play a role. Aesthetic medicine should always focus on boosting confidence in a healthy and balanced way, rather than chasing unrealistic ideals. Prevention. Protecting your skin from premature aging. As mentioned earlier, patients in their early 20s shouldn't undergo procedures to treat aging signs. Instead, the focus should be on prevention. Think of it like this. We brush our teeth daily to prevent cavities. We don't wait for tooth decay before starting a proper dental care routine. And the same principles applies to aging. Adopting certain habits early on can significantly impact the way we age. In the Western world, the beauty ideal often includes tanned skin, leading many young women spend hours in the sun despite the well-known risks of UV damage and accelerated aging. I often notice that very young girls don't see aging as an immediate concern, making them less mindful of long-term consequences. However, I strongly advise against excessive sun exposure and recommend daily SPF to protect the skin. For those who still want a bronzed look, self-tanners and spray tans are excellent alternatives that don't come with the same risks as UV exposure. I actually made a YouTube video about this in the past. Mid to late 20s. The first subtle signs of aging. As we move through our 20s, establishing a solid skincare routine becomes even more important. A good moisturizer, retinol, and vitamin C can be highly beneficial for prevention and should gradually become part of your daily regimen. However, if you have existing skin concerns, retinol and vitamin C might not be the best starting point. Consulting a qualified skin therapist or doctor can help tailor the best skincare routine for your needs. From the mid to late 20s, the first subtle signs of aging may start to appear, though this varies from person to person. Patients who have frequently sunbathed in their late teens and early 20s often show these signs earlier than those who have consistently cared for their skin. By the late 20s, some individuals begin anti-wrinkle injections for dynamic lines or fillers to address very very subtle volume loss. But I will discuss these treatments more in the next decade. That being said, as I highlighted in my previous video on collagen banking, the late 20s are an ideal time to start incorporating light collagen stimulating treatments like skin boosters. These help maintain skin qualities, hydration and elasticity, delaying the visible signs of aging. Prevention remains key, and small, proactive steps taken now can make a significant difference in the long run. 30s. The first signs of aging and effective prevention. Now, moving into the 30s, this is the decade where more people start to notice the first real sign of aging. Some might already see these changes in their late 20s, while for others, it becomes more apparent in their early 30s. One of the first things we typically notice is dynamic wrinkling. Those fine lines that appear when we make facial expressions. Think of forehead lines, frown lines, crow's feet, and nasolabial folds. At the same time, the superficial fat pads in our face begin to shift slightly. And we also start to see volume loss due to the deflation of deeper fat pads in the mid-face. For some people, especially those who are very athletic or have a naturally lean face, this volume loss can be more pronounced, particularly under the eyes, the infraorbital area, and the temples. We might also see subtle descent of the eyebrows, and the jawline can lose a bit of its sharp definition, which was naturally more structured in the early 20s. Another common change is pigmentation issues. Sun damage from earlier years can start to show up as uneven skin tone, sunspots, or melasma. The right time for anti-aging treatments. This is definitely the time to get serious about anti-aging treatments while still focusing on prevention. And honestly, the 30s are a great decade to get amazing results with non-surgical treatments. I personally think that facelift surgery is completely unnecessary at this stage. It's way too early. But this is a decade where subtle, strategic treatments can keep you looking fresh and youthful without obvious changes. If you haven't started in your late 20s, then now is a great time to begin with neuromodulators for dynamic wrinkles like crow's feet, forehead lines, and frown lines. Since volume loss starts to become noticeable, this is when strategically and conservatively placed dermal fillers can make a big difference. The key here is balance. It's not about overfilling one specific area, but about maintaining natural looking proportion. And beyond fillers, collagen stimulating treatments should become a priority. These include certain skin boosters, biostimulators, lasers, microneedling, chemical peels, and energy-based devices. The goal is to keep the skin tight, elastic and strong, so that it doesn't start sagging as much in the following decades. Skincare becomes non-negotiable. Your skincare routine should now be an essential part of your daily life. If you've been a bit inconsistent in your 20s, this is a decade where you can't afford to skip it anymore. At this point, SPF is non-negotiable, and limiting sun exposure is crucial. No excuses. Retinol in the evening and vitamin C in the morning are also great additions to keep your skin firm, bright, and even toned. However, as always, your routine should be tailored to your skin type. Some people might need to address other concerns first before jumping into active ingredients like these. Becoming more conscious of aging. One thing I notice is that people become much more aware of their aging process in their 30s. This is often the first time they actively think about visiting a doctor to discuss their concerns. Many patients come in focused on a single area. For example, they might be worried about under eye hollowing and want teardrop filler. But in reality, treating just one isolated area often doesn't give the best or most natural results. Take the under eye area, for example. Yes, teardrop filler can help, but one of the biggest reasons this area looks hollow is due to mid-cheek volume loss. If we first restore volume in the cheeks, a lot less teardrop filler is needed, and the results look much more natural and balanced. For under-eye concerns, skin boosters, PRF gel, or polynucleotides can also be great options since they improve the quality and hydration of the skin, not just the volume loss. A holistic approach for the best results. Personally, I believe in a holistic approach. When treatments are combined strategically, you get the best, most natural looking results. The biggest mistake I see, patients who want a quick fix in one area, like just filling their teardrops or just fixing their jawline. But when we only treat one spot without looking at the bigger picture, the results can actually look more obvious, and that's exactly what we want to avoid. The key is subtle, well-balanced adjustments that enhance your futures without looking like anything was done. And that's what I love about working with non-surgical treatments in this decade. It's all about keeping things fresh, natural, and preventative. 40s. Advanced signs of aging and effective treatments. By the time we reach our 40s, most people start to notice more advanced signs of facial aging. These changes become more visible in different areas of the face, and the rate at which they appear can vary depending on several factors, including genetics, lifestyle, and sun exposure. Research shows that skin types play a big role in how quickly these signs develop. Women with lighter skin tones tend to show aging earlier than those with darker Fitzpatrick skin types, mainly due to differences in collagen breakdown and melanin protection. One study compared Caucasian women living in Australia who had high lifetime sun exposure with Caucasian women living in areas with less sun exposure. The results were striking. Those exposed to intense sun showed signs of advanced aging up to 20 years earlier. This is a perfect example of just how damaging UV exposure can be over time. Hormonal changes and accelerated aging. Another big factor in this decade: menopause. Many women, especially in their mid to late 40s, start experiencing hormonal fluctuation, primarily due to declining estrogen levels. And this has a huge impact on the aging process. Menopause-related changes can lead to skin concerns, including acne, collagen loss, and thinning of the skin, which contributes to sagging. Bone changes, such as jaw and chin reduction, and a loss in bone mineral density, which affects facial structure. Fat distribution shifts, leading to hollowing in some areas and heaviness in others. And then more exaggerated signs of aging in individuals with atrophic acne scarring, as the skin becomes thinner and loses its ability to support tissue as well as before. A more comprehensive approach to treatments. Because the signs of aging progress more noticeably in this decade, treatment plans should be comprehensive. This means that a combination approach using different types of treatments tend to give the best results. At this stage, we're not just treating wrinkles anymore. We need to address volume loss, skin quality, and structural support. And that's why treatments in this decade often involve a mix of neuromodulators, toxins to soften dynamic wrinkles, fillers to restore lost volume and maintain facial proportions, biostimulators to trigger collagen production for firmer, tighter skin, energy-based devices, lasers, microneedling, and chemical peels to improve skin texture, elasticity, and overall quality. In general, this is a decade where aesthetic treatments require a bigger budget because achieving the most natural and refreshed results often involves multiple treatment types rather than just one. Starting collagen-stimulating treatments early. One of the most important things to note is that collagen-stimulating treatments work best when started before menopause. The sooner you begin biostimulators like PLLA, Sculptra, the better results you can achieve in terms of preventing skin laxity and maintaining volume. In the early 40s, introducing biostimulators can be a great way to increase collagen production, improving skin tightness, and restore natural-looking volume, especially when combined with other supportive treatments. Realistic expectations and aging gracefully. At this stage, realistic expectations become even more important. This applies not only to women in their 40s, but also to those in their 50s. It's unrealistic to expect that someone in their 40s will look exactly like they did in their 20s. And honestly, that shouldn't be the goal. The best and most practical approach is to focus on looking well proportioned, refreshed, and slightly younger than your chronological age, rather than trying to turn back time completely. Attempting to create too much contrast between chronological and perceived age can actually lead to results that look imbalanced or overly done. Instead, the goal should always be to maintain natural harmony in face. The 40s are still a decade where non-surgical treatments can work incredibly well. With strategic, well-planned treatments, you can maintain a youthful, healthy, and refreshed look without looking overdone or drastically different. 50s, advanced aging changes and the best approaches. By the time we reach our 50s, the aging process becomes more advanced, and we start to see a broader range of age-related changes. One of the biggest differences in this stage is the appearance of etched-in lines. These are wrinkles that remain visible even when the face is at rest. Even if someone has maintained their skin well with previous aesthetic treatments, these lines can still appear over time due to years of facial muscle movement, environmental damage, and lifestyle factors like smoking. At this stage, we also see more pronounced mid-facial volume loss, which is often linked to hollowness under the eyes. Deeper teardrops and more severe nasolabial folds. Lines around the mouth can also become more etched in as the skin loses elasticity. Surgical versus non-surgical interventions. In this age group, non-surgical treatments can still make a significant difference, but for some individuals, they may not provide the most satisfying results, especially in cases where there is a high degree of skin laxity and severe sun damage. For patients with severe sagging, deep folds, and excess skin, surgical procedures like facelift surgery or blepharoplasty for the eyelids might be better suited for achieving the most natural and long-lasting improvement. That being said, non-surgical options have advanced significantly, and for many patients, they can still provide great rejuvenation, but it's important to have realistic expectations. At this stage, improvements happen gradually over time, rather than in a single session. A personalized approach. Looking at past photos. When I consult with patients in this age group, I often ask them to bring pictures from their 30s. This helps us analyze how their facial structure has changed over time. And from there, I can explain what can realistically be improved with non-surgical treatments. Combination treatments for the best results. For patients in their 50s, achieving the best results often requires a combination of treatments that work together to restore volume, improve skin quality, and refine facial contours. Some of the most effective treatments include neuromodulators, toxins, for both the upper and lower face, including neck, to soften dynamic wrinkles, fillers to restore lost volume, define a sagging jawline, enhance the midface, and soften the lines around the mouth. Collagen biostimulators to boost elasticity, improve skin firmness, and restore volume gradually. Fat dissolving injections for the lower face to redefine and reduce heaviness under the chin or along the jawline. The key in this decade is customization. Not every patient needs the same approach, and it's about finding the right balance between different treatments to achieve the most natural and refreshed look. 60s. Surgical versus non-surgical options. By the time we reach our 60s, the signs of aging are much more pronounced and affect not just the face, but also the neck, décolletage, hands, and even the feet. One of the biggest structural changes that happens in this decade is the transformation of the inverted triangle of youth, which we typically see in the 20s and 30s, into an upright triangle. This shift happens due to a combination of gravity, skin laxity, and volume loss in the upper face, which makes the lower face appear heavier, when surgery becomes the preferred option. For patients in this age group, surgery is often the best solution to address these concerns effectively. In my practice, when a patient in their 60s comes in with concerns about jowls, deep nasolabial folds, or severe sagging, I generally refer them to a plastic surgeon for facelift surgery. At this stage, skin laxity is usually too advanced for non-surgical treatments alone to achieve satisfying results. Of course, this video is a generalization, and there are exceptions. While most patients in this decade benefit more from surgical intervention, there are still some individuals who no smoking, and a consistent skincare routine. Because their skin quality is better preserved, they may still seek significant improvements from non-surgical treatments. There are also patients who, for personal reasons, do not want surgery at all. In these cases, non-surgical treatments can surgical options. It all depends on their skin quality, lifestyle history, and expectations. Whether someone chooses surgery or non-surgical treatments, the goal is always the same: